Now, climate change, global economic recovery post-COVID-19 and unequal vaccine sharing are expected to become some of the contentious issues on the Group of Seven. That's the G7 leaders' agenda in the next 3 days. They are, of course, meeting in the United Kingdom. The group's members, the United States, Italy, Japan, Germany, France, Canada and the United Kingdom, meet annually to coordinate global economic policy and also to address other transnational issues. President Cyril Ramaphosa has been invited to attend the summit and is expected to canvass members and for equitable access to COVID-19 vaccines for developing countries, among other things. So to talk to us more about this, we join on the line by Duma Gqubule, who's the founding director at the Center for the Economic Development and Transformation, and Fatima Hassan is director at the Health Justice Initiative. Duma, Fatima, thanks to both of you. Welcome to Morning Live.
Thank you. Well, thank you, Sakina.
Duma, let me start with you. Let's start with the relevance of the G7, and also given that we are now faced with a pandemic, is it business as usual? Are those going to be the main issues to be discussed, or is it time for a change?
Thank you, Sakina. So the first thing I have to say, for the president, this is a welcome diversion from the chaotic and shambolic public health response to the crisis and the withdrawal of the economic response by the government. This was a terrible week for most South Africans. The government has withdrawn humanitarian relief, and people were left with Stage 4 load shedding to cope with, and we have only fully vaccinated 0.8% of our population. So in terms of the G7's relevance, I find, China is not invited there. China is the second largest economy in the world. And in terms of developing countries, there's only India and South Africa that was invited to this meeting. I don't know on what basis we qualify to be representing the whole of Africa. We and India had the most shambolic response to the coronavirus in the world. And South Korea and Australia, who have also been invited, had some of the most impressive responses to the pandemic. So yes, I think we should question the relevance of the G7. But the main thing, Sakina, is that there's two gaps in terms of the world economy. There's a gap in terms of economic growth. The world economy will grow by about 5.6%. And the main reason for this is that the stimulus packages that we saw globally were about 17% of world GDP, about, I think, $16 trillion, and about 15, and in the developing countries, it was about 5% of GDP in developing countries, the stimulus responses. Now, in terms of quantitative easing, that accounted for about printing of money, 15% of GDP in rich countries. And the second reason, and in developing countries, is about 3% of GDP. So I don't understand why in developing countries, including South African, there's been a hesitancy to print money to be able to respond to this crisis. The second gap, which I'm sure Fatima will talk about more than I will, is the gap in terms of vaccinations. In the G7 countries, 45% of the populations have received at least one dose. In the in Africa, I think it's less than 2%. In South Africa, 0.8%. So we've got this huge divergence in terms of the economic response to the crisis and also the vaccine gap. Those are the two major gaps that will be talked about. And there's talk in the G7 about donations of 1 billion doses. I'm not sure whether that's enough, but there was a proposal from the IMF that the world should spend $50 billion to vaccinate 40% of the population of the world this year, and 60% by June next year. So I think there will be talk about that, how the money will be raised at the G7. The IMF had said there should be grants of, I think, 30 billion rands towards developing countries, and those are the issues. And we talked about climate change as well. Those are some of the issues that will be discussed here.
Fatima, speaking about, the economic downfall for so many countries exacerbated by the COVID-19 pandemic, and again, speaking once more to the relevance, because surely that should be somewhere right up top, but not just as an agenda item, but there needs to be some real change. Otherwise, what is the point?
I totally agree, Sakina. And I mean, the irony of Cornwall is not lost. The G7 members are flying in with their delegations into a county in the UK, which has vaccinated more people than 22 African countries combined. And so that is the irony of the location of the G7, the timing of the G7, and also the people who have been invited. There's a political reason why South Africa and India has been invited, and that's because they're leading the TRIPS waiver proposal, which would require a relaxation of intellectual property. And they've been leading that proposal since October of 2020. There is global momentum for G7 member states to support it. So far, the US has indicated partial support, and, France in every other week indicates support and then withdraws its support. So there's definitely pressure on the UK government and the German government in particular, where some of these front-runner vaccine manufacturers are actually headquartered to support the relaxation of intellectual property, as well as transfer knowledge and manufacturing know-how, so that we can actually reach 60% of people with shots in their arms by the end of 2021 in the global south. The current estimates are, and this is the second irony, is that the G7 nations will reach their vaccination targets by January 2022. We may take 57 years at the current pace of vaccination in the global south to reach those kind of levels. So that's definitely unfair, and that smacks of vaccine nationalism and vaccine apartheid. And the third irony is that the G7 nations only represent 10% of the world's population. So there's a certain mismatch in the availability of vaccine supplies and the allocation of countries with such a small global population, but basically having excess supplies. And Duma's right, donations are not sustainable. Donations are a form of charity. That is not going to be a sustainable solution to the very pressing issue of limited supplies of vaccines around the world, especially in Africa.
So, Duma, we saw first of some of the richer nations denying that they were actually hoarding vaccines, but this has now been proven. And the developing countries, as Fatima points out, we are lagging far behind. So what sort of conversations should the G7 leaders and the invited guests be having around vaccine equity and also the distribution that is currently underway in order to save more lives in the global south especially?
Sakina, I think we must have there should be two discussions there at the G7. The first one is about the inequity in terms of economic development, because there's a humanitarian crisis in the developing world because of this crisis, because of the pandemic. And the economic response by most developing countries has been inadequate. So that's the first issue in terms of inequity. And there must be financial support to help these countries to respond to the economic crisis. That's number one. Number two, in terms of vaccine equity, obviously there's an issue of that Fatima was talking about, that there should be relaxation of intellectual property so that we can manufacture these vaccines, intellectual property rights. The second thing, there has to be grant funding to developing countries to be able to purchase these vaccines. And so those are some of the things that have to be done, and that's what I think we should do.
But if we think about it, you have the richer nations whose vaccination drives, for the most part, are going swimmingly. And even where there are hiccups, it's not because of a lack of vaccines or access to vaccines. And, we go there and we sit around the same table with these countries, literally begging, to be given a fair deal here. But are our leaders really in a position to do so, or are they going there once again to just, be nice, be cordial and beg, Fatima?
So we're hoping that this time it's different. And if you see the vehement opposition by the pharmaceutical industry and especially the G7 member states to the TRIPS waiver proposal being led by South Africa and India, it's quite surprising. I mean, the level of opposition and the level of adversarial opposition is quite alarming and is quite something. We haven't seen this kind of behavior since, the height of the HIV/AIDS crisis. But for us, it's really, how does the G7 leaders look at President Ramaphosa in the eye, or look at the Indian delegation in the eye, knowing the crisis that is unfolding in India in particular, in parts of Nepal, what's happening in Brazil, what's happening in other parts of Latin America, and certainly here in Africa, and say that it's justified that in a global pandemic where they promise solidarity and financial support and manufacturing support, that 1/3 of the world's supplies has gone to 10% of the world's population, has gone to their countries because they did hoard, and that has been documented. They are drawing on supplies from COVAX, which we haven't even received, and they're unwilling to share the technology when there are safe and effective tools available, which is the reason why South Africa's entire rollout has basically come to a halt, because we're still waiting for Johnson & Johnson supplies. Yet in the US, they have stockpiles of J&J, which they're not releasing or unable to release. So if we were able to scale up manufacturing, and I really hope that's a key point of this G7 meeting, is how do you scale up manufacturing capacity in the global south? There is untapped, underutilized capacity. The knowledge could be shared. It could be done expeditiously within months, and we could be having a very different conversation in 2022.
Well, these are very interesting discussions that I hope that we could track as at least after this weekend as well. But Duma, South Africa's participation, and one of the questions that one will ask is whether this will boost some sort of business confidence in South Africa and also increase our investment prospects. Will it?
Sakina, as I said at the beginning, this is just a welcome diversion for the president. Our situation back home is dire. The president announced this, the electricity reforms, but I calculate that the electricity will only arrive in 2025, and it's not going to make a difference to the load shedding crisis that we're currently having in South Africa. And the investment that will happen in terms of the announcement yesterday is about between 2022 and 2025, about 0.5% of GDP a year, 75 billion rands. But on the other, what they're giving to the private sector, with one hand, it will take away from Eskom, which will lose billions of rands every year and result in more bailouts from Eskom. So they're privileging the private sector, and they're defunding the public electricity provider for us. And the electricity that they're going to provide is it's for companies. It's not for you and me and Fatima. It's so that I just can't understand about the mismanagement of the economy in the midst of a pandemic and the failure of our country to have a proper public health response. Last thing I want to say, Fatima, is that Sakima, is that our government has failed to watch this response right from the beginning. If you look at countries like South Korea, follow East Asia, they had proper track and trace policies. I don't know what happened in South Africa in terms of during when the numbers were low. What were we doing in terms of track and trace? What were we doing in terms of rapid testing and so forth? So those are the type of things. I said right at the beginning, we can't rely during 2021 on vaccines alone, because we will not, the government we have and not the government we wish we have, will be able to vaccinate the whole population. So we should have complemented this vaccine drive with other public health measures that the government has inexplicably failed to implement since the start of this crisis more than a year ago. In terms of community health workers, I saw Rwanda. They've got this amazing program in terms of community health workers, and Ethiopia. And there's so many things that we could have done to reduce the numbers in terms of, there's so many case studies throughout the world, from Ebola, the response to Ebola, to East Asia's response to this crisis, that we have just inexplicably failed to implement as a country. And now we are seeing 1.7 million infections. I can't remember the last number in terms of excess deaths, which was 160,000. I can't remember. It is a calamity, yeah.
And we're out of time, but Fatima, just very quickly, what would you, as the Health Justice Initiative, like to see these leaders discuss in terms of agreement, in terms of vaccine equity and accessibility?
Well, I think from the available existing supplies, there needs to be a fairer allocation of existing supplies, which needs to be diverted to the Global South quite soon, so that at least healthcare workers in the Global South can all be vaccinated, and people over 80. And what we'd like to see is an outcome around, a lack of an opposition by some of the G7 member states to the TRIPS waivers, so that we can really get those negotiations wrapped up so that we can scale up manufacturing. In South Africa, we'd like to know where is the National Coronavirus Command Council. We have an acting Minister of Health from tourism. We have a minister who's been placed on special leave. We have an economy in crisis. We have people going hungry. We have a healthcare system that is really taking strain with the onset of wave 3 in multiple provinces. So we have a real crisis on our hands. We have no supplies from J&J. We have a drip feed of supplies from Pfizer. We have only 2 vaccines in our vaccine selection, basically arsenal. And so, there's some tough decisions that are going to have to be made. And so to prioritize people who shouldn't necessarily qualify for vaccination in this context of scarcity, in this context of inequality, I think for us is even more concerning.
Well, thank you so much for your time this morning. And as I said, I hope we can catch up after this G7 summit. But thanks, Duma Gqubule, Founding Director at the Center for Economic Development and Transformation, and Fatima Hassan, a Director at the Health Justice Initiative, talking to us about expectations for this year's G7 summit being held starting today in the United Kingdom. With that, let's get on to your headline news.